So here we're going to talk about a very, very interesting case because it kind of goes back to something I've talked in the past about physical exam, how you just have to not trust it. This gentleman, 80-something years old, presents with abdominal pain, lower abdominal, has had 1 or 2 episodes of vomiting overnight. One of them was yellowish, the other one was brownish, and he had a history of diarrhea or soft, very soft, large bowel movements for the last 3 days. So vomiting, diarrhea. On exam, he definitely was tender in the left lower quadrant. I wouldn't quite say rigid, but definitely a little bit of guarding on exam. But bowel sounds were hyperactive, not hypoactive or absent, but actually hyperactive. His belly was not distended. He was not actively vomiting. And remember, he gave a history of diarrhea for the last 2 to 3 days. So let's look at the pictures. So this is his x-ray, actually a CT scan of his abdomen. On the lateral view, obviously you can see he's had some back surgery, but there's a lot of distension, a lot of gas. Let's look at the AP, and look at that. That's a very distended loop of bowel. Look at that round collection of gas and fluid. A lot of stool collected over here, and a big chiliditis. We talked about that in the past. So now let's look at the CT scan. This is on an anterior posterior view and see what that looks like. You got liver over here, spine. We're moving forward in the abdomen. It's got some bad spine disease down here. Actually, we're moving back on him, so let's move forward in the abdomen. You can see the big loops here. Big piece of gas and another loop of bowel within it. Looks like almost like the magicians and the balloons. Look at it here. So it's on the chest, liver here, heart, spine. Keep coming down. Big dilated loop of bowel, spleen over here, aorta, kidney, some stool filled loops of bowel, lots of stool here, nothing there, just gas and air. And here he has some, he had peripheral vascular disease, has a bypass on that side. See, there's metallics, that's from stents and stuff like that. So the really most prominent finding is on that scout view. Let's look at it again. We are, that's the scout view, and that's very, very typical volvulus.